55% of young people say they will get COVID-19 vaccines. That's according to a report by UNICEF. The report also found that 37% of young people believe TV and radio are the most trusted sources for accurate information about COVID-19 vaccines, followed by health workers and social media. Now let's discuss this further. We're joined via Zoom by Christine Muhigana, who is a representative of UNICEF South Africa. A very good afternoon to you, Christine. Thank you so very much for availing yourself to SABC News this afternoon.
Good afternoon. Thank you for having us.
All right, take us through this study. It's quite an interesting study and what you found. When was it conducted and what was the sort of methodology that was used in conducting the study?
So we just conducted it now in August. Actually, we were planning to have the results ready for the eligibility of young people, 18 and above, to the vaccines. But as you know, we were taken over by events because the date was brought forward to 20th of August. So our this poll, the results of this poll are coming now at the time when a good number of young people over 18 years of age have actually now brought momentum to the vaccination against COVID-19 in the country. As you know, more than 1.3 million young people aged 18 to 34 have now received the COVID-19 shot. So this poll, which was administered in over 5,000 young people nationwide in South Africa, is telling us, as you recall, that 55% of young people would actually get vaccinated if they are offered the opportunity. So that actually somehow confirms the fact that we see so many young people getting vaccinated, but it's far from the 100% that we would want it to be. But the good news is that 86% of young people are actually saying that they are aware that the vaccine is important to them, that it would protect their health, protect them from infection. So that means that we need to understand why there is hesitancy, and this poll gives us some, elements, indications to work with. You referred to one in your introduction. Young people trust television and radio. Traditional television and radio as a good source of information that's followed by health workers. That means that's how the information should be getting to them. Actually, social media comes a little bit behind as being trusted by 13% of young people. So as we just heard in the previous reporting that you aired, we need to make sure that young people get the right information, the correct information, and also that we ask them to convey the message to their peers.
I just want to continue on that issue of hesitancy. How much of a factor is that hesitancy? I mean, the fact is you found that 55% of young people are saying it's fine, I will or I have taken the vaccine, but there is that it's still a big number of 45% who are not. When I was in school, if I got 70% for a test, my father would ask what happened to the other 30%. So what is happening to that 45%? It's quite a significant number. So
22% of the respondents to our poll said that they will not get the vaccine, but there are 23% who say they are unsure. And when you look, a little bit further, if you dig a little bit further as to why there is hesitancy, 60% said that they are worried about side effects, and a proportion of the young people are also saying that they are worried about the actual efficacy or effectiveness of the vaccine. So again, that means that we can work on those who have hesitancy because of those parameters, and make sure that they are reassured about the side effects and also the efficacy or effectiveness of the vaccine. And again, they trust the information that they receive through television, radio. So therefore the importance of media being the messenger of the correct and right information on vaccination against COVID-19.
You know, you use the word reassure, and one of the things that I've picked up, if I'm to look at social media, when there's ever discourse or discussions or debate around vaccines, you know, the moment that people are asking and very valid questions around the issue of side effects or the efficacy, those sort of questions tend to be shut down. It's just a case of go get the vaccine. And I wonder if we're adequately addressing, and maybe this is also on the side of media, also properly addressing the issue of hesitancy. Some people are not, in fact, anti-vaxxers, as what's being the loose terminology that's now being used for anyone who's not getting the vaccine. Some people are genuinely hesitant and have genuine questions, and I'm worried that those that are hesitant are now being mixed up with those who are anti-vaxxers, and that's something that I wonder if we're adequately sending out that information, even though they trust the media and they trust television and they trust radio. I understand that, but the fact that we are sitting with 45% of those saying I still won't means that there's not enough information. Then is that what it points to?
Absolutely, and it actually reassures us or reinforces the fact that we need to do more campaigns with the right people, so with media, with health workers, with the African Union, TikTok, and one campaign. We launched a campaign called Myth or Vax. Yeah. This includes, using quizzes where we engage in live sessions with people so that, they can interact with celebrities, with health experts through media, to make sure that, the dialogue around the safety and efficacy and, how to deal with side effects is aired and is discussed in a good manner. In South Africa, for example, we're using one of our advocates, Mabo Nyane. He will talk to Professor Abdul Sarim Karim. This is something that we hope will happen next week, and young people will follow. We're also working with young volunteers, UNICEF volunteers. They're leading a campaign called Grandkids for Go-Go's, and they're assisting elderly with vaccine registration. Again, we make sure that these young people carry, the right information, correct information, so that, those people that they interact with, those people that they are helping in going to the vaccine sites, get the information, that's correct and reliable. We also have a truck, a multimedia truck that brings COVID-19 messaging to communities. And again, what we do there is make sure that we have people from the community speak to their peers, to people around them, carrying the right information. This truck actually also brings information on other health services, which is also important. And the last thing that we're doing with partners, and of course this is all complementing other efforts that are being done in support of the national and provincial departments of health. So we've deployed a campaign called Zwakala. So this is something that's done by the United Nations, and we are part of that effort. And what we do through that campaign is featuring young people who are role models in the country, in the community, and again, who are conveying the right messages about the vaccine, but also all the other non-pharmaceutical interventions to prevent COVID-19.
All right. It was a pleasure speaking to you. Thank you so very much, Christine, for giving us your time here on SABC News. Much appreciated.